and I'm talking about India as a prototype of, say, the developing Asian world. So I will talk about the strategies which are now going on in terms of dealing with the growing non-communicable disorders. CVST is one part of the strokes, and stroke is one part of NCDs, and they're all interlinked. When you're looking at hypertension or diabetes, when you're looking at cardiovascular or cerebrovascular health, and cerebrovascular health, in that you have arterial and venous strokes. So in that regard, the National Preventive Strategies have identified and put a focus on stroke in general, in which CVST is one part. And also, as there is an algorithm which is now being recognized as important in strategy, your interventional programs, which grows across, whether it's Ministry of Health, the Ministry of Environment, Ministry of Transport, Ministry of Energy, and Ministry of Finances, because we cannot ignore the elephant in the room, which is the economics, and they drive everything in the world, and of course also in the Asian countries. So the government is looking into this both in terms of primary prevention, picking up strokes with the arterial or venous, strategizing the stroke chain of survival, and then go on to life after a stroke and rehabilitative strategies and secondary prevention. I think in every wheel of this, or a spoke within this big wheel, there are strategies which are coming into force. We do have a National Stroke Action Plan, which will be released soon. So I think, and just not that, we also have the research module, which is akin to, and I'd say there's Instruct in India, and I'm sure there are others also in other Asian countries. So you have these verticals which are now growing, getting focused, and they are becoming sustainable and scalable. And that's, I think, the most important thing, that whatever the efforts which are going in are being sustained, and I do see the potential of a scalability to be able to, meet with the further challenges, because the war is not won yet. So, but there is definitely light, which I can see at the end of the tunnel.